Gout is a type of inflammatory arthritis that can cause pain, tenderness, redness, and inflammation. Dietary changes can help manage symptoms and prevent flares. People with gout have high levels of uric acid in their blood. Managing these levels may help relieve or prevent symptoms. Some foods can help lower uric acid levels, while others can increase it. There is evidence that consuming certain types of food may trigger an episode of gout. In 2004, researchers found that some purines, which are present in animal and plant foods, may worsen the symptoms of gout because the body converts them into uric acid. The study indicates that consuming animal-based foods that are high in purines might increase the risk of developing gout. However, eating plant-based foods that contain purines does not appear to have the same effect. Researchers add that consuming dairy products may reduce the chances of developing gout. The following foods contain purines. People with gout should significantly limit or avoid them. Red meat and organ meat, such as liver or kidneys, which are high in saturated fat. Seafood, such as lobster, shrimp, sardines, arcovis, tuna, trout, mackerel, and haddock. Some sugary drinks and foods that are high in fructose processed foods and refined carbohydrates, alcohol, especially beer and hard liquor. Some people fast to relieve gout. However, the Arthritis Foundation notes that fasting may trigger symptoms of gout if a fasting person becomes dehydrated. People with gout should take special precautions when fasting to maintain they drink enough fluids. A 2014 study compared people who fasted and those who did not fast during Ramadan, which restricts food and fluid during daylight hours. The study did not find that people who fasted experienced more episodes of gout or higher uric acid levels than non-fasting participants. Let's talk more about gout. Gout is a chronic or long-term condition. Developing lifelong healthful eating habits can help a person manage their symptoms. A healthful diet for people with gout should include all the food groups. Foods that can help reduce uric acid levels include low-fat dairy products such as yogurt and cottage cheese, plant oils such as olive oil or avocado pulses, including beans, peas, and lentils, all vegetables including mushrooms, asparagus, and spinach fruits, especially those with high fiber and low sugar content, such as berries and citrus, whole grains, nuts, water, oatmeal, lean meat, such as chicken eggs. Overall, a plant-based diet is more likely to be beneficial than a high-fat diet with a focus on meat to help stabilize uric acid levels. It can also help boost heart health due to the increased consumption of fiber, fruit, vegetables, and monosaturated fats. This is important as studies have shown that people with gout may also have a higher risk of developing heart problems. A systematic review published in 2016 found evidence that coffee may reduce the risk of a gout flare-up. Your doctor may also recommend vitamin C supplements of 500 to 1000 milligrams each day. Vitamin C supplements are available for purchase online. However, people should not take supplements unless their doctor advises them to do so. People should speak to their doctor for advice about dietary changes. However, here is an example of a healthful menu that may be suitable for a person with gout. Here's a sample meal. Breakfast: loaded oatmeal with coffee and a glass of water. For loaded oatmeal, combine oats made with low-fat milk, berries and cherries, almonds, and walnuts. For lunch, loaded salad with leafy greens, vegetables, 1 to 2 boiled eggs, fruit, avocado, flaxseed, and a dressing of olive oil and vinegar, 1 cup of black bean soup, 1 to 2 glasses of water. And for dinner, half a cup of skinless chicken breast, about 3 ounces, half a cup of brown rice, barley or other whole grain, 1 to 2 cups of broccoli, half a cup of kefir, 1 to 2 glasses of water. And what is gout once again? Gout is a type of arthritis that occurs when there is too much uric acid in the blood. High uric acid levels can cause monosodium urate crystals to form in the joints. Severe pain, tenderness, redness, and inflammation can result. Gout mostly or most commonly affects men, but it can also affect women after the age of 60 years old. Gout flares can begin suddenly, often at night time, and it's very painful. Sometimes the pain can last from 1 to 10 days. Symptoms will be most painful during the first 24 hours. So you better prepare your pain relief medication and some home remedies with you. Gout affects the big toe, and even the weight of a blanket can cause a severe pain. Without treatment, gout can spread to other joints in the body, in both the upper and lower limbs. Treatment options. These include pain relief medications, including non-steroidal anti-inflammatories, colchicine, and steroids, drugs to reduce uric acid levels, such as allopurinol. We would like to acknowledge the sources of these articles. The Medical News Today and was medically reviewed by Natalie Butler, RD, LD, and this was written by Silvana Montoya on November 19, 2019. Thank you, folks, for sharing us this information.